think the best place to start is to remember that the patient is individual and not meant to be put into some sort of cookie cutter or a pigeonhole. Now, even though they may get stratified into one of the risk categories, high risk being one of them, that's still not taking away from the fact that that person's an individual and should be individualized as far as their care. The way a person can stratify their treatment based on the stratification of risk is by having some predetermined set of criteria they're going to be using for what types of treatments that patient may be eligible for. Just like if you go to get a loan from a loan officer and you have a poor credit score, you're not going to be offered a great credit rate. You're not going to be offered a great interest rate. You're going to be offered some lesser product. Same with pain patients. It's not that the time release or the more stringent medications you might use for the person in the high risk category are lesser products, but they have relatively less likability as far as patients wanting to abuse them and misusing them. It's not that they're less abusable or less divertible, but in general, the things that people are seeking in the open market for trade of narcotics are not the time-release fentanyl patches and the time-release morphine capsules, for that matter. Those medicines are abusable and have to be respected for what they are, but a person who's stratifying their treatment can plan ahead of time to offer things like that to patients who are in the high-risk categories.